Back here in Nevada, visit a local doctor's office and you may notice a flyer titled While You Wait. It's part of a statewide campaign to find out what impact rare diseases are having on Nevada families. Here to explain why this information is needed in Nevada is Dr. Joe Lasky, Medical Director of Cure for the Kids Foundation, Annette Logan Parker, Chair of the Nevada Rare Disease Advisory Council, and Tiffany Rubin, a mother of children with rare disease. Tiffany, I want to start with you. I said you are the mother of children, plural, with rare disease. Tell me about your children and the conditions that they are dealing with.
Yeah, so I have 4 children, 4 boys that have the diagnosis of Niemann-Pick type C. It's a genetic disease. My oldest passed away when he was 7, Jacob. And then I have my son Mason, who's 9, and my son Logan, who's 6, and my son Ethan, who's 4.
And he passed away as a result of this.
Yeah, in 2019.
What is it like being the mother of children with rare disease?
So it took us a long time to get the diagnosis. It took us 3.5 years, lots of medical appointments and testing. And as a mother, I felt this accomplishment of getting this diagnosis. And when I went and saw our local doctor to tell him, like, we finally got this diagnosis, I remember him telling us, he reminded us of the prognosis of this disease, which is not great. It's a horrible disease. And, here I tried to reassure him, like, but it's okay because things are happening every day. We could get a cure, we could get, things are happening and we can have hope. And I remember he stopped me dead in my thoughts and he said, why would anybody care about your disease? It only affects so very few worldwide. Why would anybody fund or give any money towards your disease? And I remember feeling the weight of having this rare disease, and I felt very alone. Right now, we are one of 2 families in the state of Nevada that have this disease, so there's not a big support system for us. And I just remember just feeling just that heaviness of being that our army was so small.
And that has stuck with you.
Yeah, it resurfaces quite often, actually.
Annette, as Tiffany mentioned, she is one of 2 families in Nevada with this particular disease. But when we're talking about rare diseases, how rare are they really?
Well, rare diseases as a grouping is not that rare. It's estimated that 1 in 10 Americans have some type of rare disease. And, this could be 7,000 to 10,000 different conditions. So collectively, rare diseases are not that rare.
That makes it so difficult, those 7,000 different types. I mean, doctor, do you learn about this enough in medical school? Is that even a possibility?
Well, and truth be told, even those 7,000 different rare diseases, of course, fall into a whole different number of, different subspecialties. So I specialize in hematology and oncology, but then you have, geneticists and endocrinologists and nephrologists, all of whom are going to need to be experts in some subset of these diseases. And so it's very complicated.
Okay. So, Annette, this survey, the purpose of it, what you want to determine, tell us about that.
Sure. So the Nevada Rare Disease Advisory Council has published what we call the While You Wait campaign, and it is designed to collect data statewide, and we call it While You Wait because we want to have the posters and the flyers in medical facilities, urgent cares, hospitals, doctors' offices, so that while people are waiting, they can fill out their a needs assessment. And the needs assessment is really geared towards collecting not only the prevalence of rare diseases, the types of rare diseases, but also the experience of the rare disease so that we can accumulate all of that information and help our lawmakers and our Department of Health and Human Services and the governor's office understand what can be done to improve the experience, whether that be improved access to lab testing, whether it be, access to out-of-state care that we don't currently have here. It's a challenge to get these families what they need. And we're hoping that the information that we gather, it's a 3-year campaign. So we're going to be collecting data for 3 years, and we'll publish that data annually. And our goal is to provide high quality, verifiable information so that people can make good, well-informed decisions.
You want to find out about the experiences of these families. We just heard from Tiffany, who described her experience with the doctor saying, why are people going to care? Why should people in this state care?
Well, that's a complicated answer. You know, there's the economic impact of undiagnosed rare diseases, and what does that look like, which can be extensive. Well, other studies have shown that it can be as high as $500,000 per patient in unnecessary testing and medical interventions because of a rare disease not being promptly diagnosed.
Wow. Tell me more about why people should care.
Well, and I think that it's the human piece too. You know, if 1 in 10 Nevadans is suffering and living with and dealing with some type of rare disease, that's a significant part of our population. And I think that they deserve to have the best access and the best care that we have available.
Doctor, yes, please go ahead.
And some of these diseases, genetic or malignant diseases, it's very critical to diagnose them early. And there are some treatments that only work if you start them in the first year of life, or if you start them later, they're not as effective, and those children can go on to have bad outcomes. And so, having the knowledge in place for both pediatricians and the public just to know, to be aware that these diseases exist and to have the correct testing and the correct facilities to diagnose these kids is incredibly important. Again, not just to prevent, healthcare costs, being higher for those patients, but to take the best care of those children and really give them better qualities of life.
And you are,
Yes.
it took us 3 years to diagnose my son. And every week we watched digression. And had we got him something earlier, it could have turned his trajectory a different way. There's no way to tell, but we just watched him go a different path. So,
And we talked prior to this about every 6 months, what happens to your family?
So for the last 6 years, we've been receiving a treatment at Cure for the Kids. And every 6 months, we get a denial from insurance saying that they can't get their treatment. So every 6 months, we have to appeal the insurance to get our treatments.
And that's private insurance?
Our kids had Medicaid.
Okay. And that's common, as you were telling me, Annette.
It's very common.
Why? Will you explain that to us?
Well, I think that in the electronic system, there's some sort of cue that triggers an automatic denial.
I was specifically referencing that children with rare disease are Medicaid patients. Many of them are. Why is that?
Oftentimes. Well, I think, at Cure for the Kids, 54% of our entire patient population is a Medicaid beneficiary. And then if you pull out and just focus on the rare diseases, that goes as high as 75%. Who has young children, but young families, right? And whether they're not employed, where they have a robust healthcare plan available to them, or they're working 2 jobs as they're building their family. And so young people have children, and oftentimes they're not adequately insured. And then once the rare disease is diagnosed, or the symptoms of a rare disease present themselves, so many times one of the parents needs to become a full-time caregiver. And so the family income decreases significantly. And so they fall into that category.
I want to go back to the testing. There is, diagnosis. You had talked about genetic testing being crucial to diagnosis, correct? But what troubles are you facing just in genetic testing?
So there's a number of situations and diseases where there's now some relatively simple, PCR-based or genetic testing that could give us the diagnosis very quickly. And we're putting, dozens of requests in each week to, that has to go through the insurance company to get authorization. And we're getting denials for those tests very regularly. And it's resulting in me having to make phone calls and write letters. And I would say at least 50% of the time, even with all of that effort, we still end up with a denial in the end.
Is this something you experienced, Tiffany?
Yeah, early on, we actually went down to UCLA, and when the doctor told us we would need this test, he said we could go with the insurance route, but it would take us a long time to get approval, or you could just pay $10,000.
Huh. Yeah. Who just has that kind of money available? What kind of laws would you like to see enacted, even without this data prior to having it, which will support your cause once you get that data?
I really do feel that laws that support access to genetic testing is critical. I think that, if you, like, say, for example, for people who are insuring lives in Nevada, if we could have, through legislation, a statute that says if you're insuring lives in Nevada, then you need to provide access to these genetic testing. And, that's not one of those where everybody can get a genetic test. It's when a physician has done the diagnostic process and they feel that this is the best option for a quick diagnosis, they should be able to do that in an efficient and timely manner. And that just doesn't happen within our state.
So the state of Nevada could make a law that said if you are insuring people in Nevada, you have to approve these genetic tests. So once you get the diagnosis, then there is the treatment. Let's talk about the availability of treatment in Nevada. How available was it for you once you finally got that diagnosis?
Well, we were the only family in Nevada at the time, so we didn't have a treatment. So we had to go down to California every 2 weeks. We did that for 8 months before we could set up a treatment center here in Nevada. So ever since then, it's been great. We've been able to get our treatment at Cure for the Kids.
From your experience?
And so the treatment that's given is still investigational. It's not technically FDA approved, and so it's given in the form of a clinical trial or an expanded access trial. And so we had to put through, IRB materials and regulatory stuff and a lot of hoops to be approved as a site to even administer this medication.
It took months of work.
As you're watching?
No, so we were going down to California.
But
Okay.
having to travel
So,
every 2 weeks.
every 2
Los
weeks.
Angeles, yeah. Which has risks.
Yeah.
That's all I can say. Yeah.
In here
With 3 little kids.
right? The Nevada Rare Disease Advisory Council, this was established back in 2019 during the legislative session. And at that session, there was a mother who testified. She was the mother of a 6-year-old son who had passed away. He had leukemia. And she said, quote, "Our family was shocked that our highly trained, capable, and trusted pediatrician was not able to identify and diagnose any symptoms of the childhood disease. We were even more shocked to discover that our pediatrician was himself a childhood leukemia survivor. Without an established rare disease advisory council within Nevada relating to the prevalence and treatment of rare childhood diseases, our pediatrician was not able to pick up the symptoms that could have been addressed and potentially saved Carson's life." Doctor, is this a Nevada issue solely?
I would say it's certainly not a Nevada issue solely, but I think the answer, again, has lots of layers and is more complicated than something easy. Yeah. And so, one important thing to understand is that, leukemia, just like a lot of other genetic diseases, is a rare disease. And if a child presents with fever or a headache, the chances that they have leukemia is still really, really, really low. And if you're a pediatrician who's seeing 50, patients a day, many of whom have fevers and headaches, it can be difficult to separate out a significant leukemia from just a cold or the flu. I think one of the things that could improve upon that in the state is just getting more pediatricians here. We rank at the bottom of the list when it comes to, per capita pediatric care, as well as for pediatric subspecialist care. And so something that could help that is by getting more medical schools here in the state, getting more, academics here in the state, and then recruiting more pediatricians and pediatric subspecialists to, really help out to care for this rapidly growing population we have.
We know that if there are residencies available, there's a likelihood that someone who's doing a residency in a certain location will end up staying and actually practicing there. What is the state of that in Nevada as far as pediatricians?
So at this point, we have one small pediatric residency program just in Las Vegas, and that's really for the entire state. And so that's obviously not enough.
What would you add to that, Annette, as far as the amount of support here for physicians involved in pediatrics?
Well, I think that a big part of a root cause analysis would show that the reimbursements, particularly for Medicaid, is not favorable to attract physicians to want to come and practice here. So, that's an unfortunate part because they're coming here to an environment that doesn't have good infrastructure and good support for their practice. And then they're also, paid at a much lower rate than some of their colleagues across the country would be paid to provide the same service. And so that doesn't create an incentive for people to want to come here.
And so then the data from this survey, could that change that?
Well, I think that it could change it because we'll have a clear picture of what is happening here. And like Dr. Lasky had mentioned, so many of these rare diseases require pediatric subspecialists. And, in order to attract pediatric subspecialists, we need a solid infrastructure for them so that they can practice their skill, safely. And so there's a lot of things that need to happen in order to improve things for pediatric healthcare in Nevada. I think that the needs assessment will create the foundation that will establish some important conversations with our lawmakers and our Department of Health and Human Services. And I think that all progress starts with a conversation.
Okay, and I have one last question that I can fit in. Tiffany, tell me how your children are doing and how this disease impacts them on a day-to-day basis.
So like he said, it's our treatment is just a treatment. It's not a cure. So we do see disease progression. In our disease, they lose their life function. So my sons are losing their ability to walk. They're losing their ability to talk. So we do see disease progression. So we just take life day by day and live with hope that, things can happen. And with things that are happening, we might have more people that are coming and different things like a cure that could happen. And, you never know what will happen.
Thank you so much for sharing your story with our viewers, and thank you to our panel. Thank you for watching.